Welcome to the BDA Takeaway.
Across the state of Washington, more than 1,000 childcare providers have closed since the onset of the pandemic. And as recently reported by the Seattle Times, a survey conducted by the Childcare Aware of Washington, a nonprofit that supports providers and their families they serve, showed that almost 1,700 businesses, 45% of those responding, have considered shutting permanently.
We have the statewide report, but what's happening locally? We asked the Primrose School of West Bellevue to walk us through the precautionary steps necessary to remain open, and a few questions about its industry in the middle of a pandemic.
Hi, I'm Shannon Peterson, the franchise owner of the Primrose School of West Bellevue. I'm here today to talk about operating a child care center during the COVID-19 pandemic. We know this has been an extremely challenging time for everyone, and it's been our goal and focus to make this as smooth a transition as possible when implementing all of our new protocols and enhanced regulations in order to create a healthy and safe environment for our school community. We have attributed our ability to remain open to the effective collaboration with our families and the diligence of our staff in implementing our enhanced protocols. It all starts at home with our families and staff being diligent about their quarantining, social distancing, and wellness checks. We ask all of our families and staff to take their temperatures and do full wellness checks at home prior to coming to school. And then once they enter through our doors, we ask the same wellness questions recommended by the CDC. We discuss any travel, and we take a touchless temperature as well as have a touchless sign-in system. The parents are actually only dropping off at the classroom door, minimizing the spread and introduction of any new and unnecessary germs into the classroom. Once inside the classrooms, our teachers help the children wash hands first things first, and then throughout the day we have enhanced sanitization protocols in place of all toys, equipment, furniture. We also have social distancing strategies now where we have moved furniture so that the children have more space when they're sitting at their centers, and we've spread out the centers so there's more space for them to social distance throughout the day. It all goes down to our nap time as well, where our cots are spread out even further than before. In addition to our enhanced sanitization schedules inside the classrooms and communal spaces of the school that happen throughout the day, we're also sanitizing and cleaning the outside playground equipment in between each classroom use. At the end of the day, our teachers do one last final cleaning very thoroughly of all of the toys, equipment, furniture in the classroom before our cleaning crew comes in the evening to do an enhanced cleaning of the entire school. We've also invested in a halo disinfecting system, which fogs the school after hours, killing most all bacteria and viruses throughout the school as well.
Now time for the takeaway Q&A. How has uncertainty caused by the pandemic impacted your childcare business?
Despite all of our hard work and efforts with our enhanced sanitization schedules and health and safety protocols, we're still at a high level of risk to COVID-19, and this creates a lot of stress and anxiety in our community. There are also many challenges that we still face today. Being on the front lines throughout the entire pandemic with limited guidance and increased risk to exposure, working a full day in a face cover with a clientele that deeply depends on facial cues, making sacrifices to maintain our quarantine community and limit the exposure to the school, and being exhausted and trying to get as creative as possible to implement new guidance and protocols in a sustainable manner that doesn't negatively impact the overall experience of our families and our staff.
What's one of the biggest operating challenges you're currently facing?
The financial challenges of operating so far outside of our business model with mandated lower capacity while trying to maintain the employment of our staff has been extremely challenging.
What insights can you share about COVID-19 impacts on the childcare industry?
It is estimated that roughly 15% of our nation's childcare capacity will either permanently close or not reopen after temporary closures. This is going to be very trying for the entire nation in an already overburdened industry where there weren't enough spots and spaces for children in the first place.
What's your message out to the community as a child care provider in the midst of a pandemic?
I'm reminded daily in conversations I'm having with our families and our staff that in addition to the challenges we face operating a child care center, there are still many challenges we all face as a community as well. Whether you're returning to work and needing to look into care for your children, or possibly an employer whose employees need to find good care options for their children so that they can perform their jobs, We all need to support each other and understand the significant changes and limitations that will continue to shape how we look at and operate our schools and the overall care of our children.
This has been the BDA Takeaway. Thank you to our supporters, Heritage Bank, Kaiser Permanente, Puget Sound Energy, and Vulcan Real Estate.
The Takeaway was produced by the BDA, aka Bellevue Downtown Association, a nonprofit membership organization committed to strengthening the economic and cultural vitality of downtown Bellevue. And with the Takeaway, share bits of information to help us tackle these trying times.